we can argue this is not, a good way to evaluate applicants, but, in reality, people still do it, right? We all know that. And people will still look at your scores, and those are already done with. But the things you can focus on now that will be really important are your network, your research, and your letters of recommendations. And those are extremely important. So I would recommend as early as you can. I know the first few months of residency are busy, but I think don't let more than 6 months pass without contacting some cardiologist in your institution and start to do some research with them and start to build collaboration and get them to know you.
So I agree with everything that you just said. Something that helped me when I was in residency is anytime there was a conference that I could submit an abstract to, I would do it. And if I could use that as an opportunity to expand my network with the cardiologists or the fellows at my institution, I would try to do some sort of case or something with them. And then at the conferences, it's also a great opportunity to network and meet people. So that's one way to build your CV. Another thing I did is I looked at my seniors and my mentors. I looked at their CVs to see where they were submitting abstracts to and what kind of research they're involved with, so that I knew where I would want to submit things and what kind of research I could ask people to be involved with. Because when you approach someone and say, hey, can I do research with you? It's a different meaning than if you go to someone and say, hey, I saw that you're working on this project about TAVR outcomes in patients with severe aortic stenosis who have really small annuli. Can I help you with that? Is there anything I can do to get involved? That's a lot more meaningful. And then the other thing I would say is be genuine. Like if you have no interest in aortic stenosis, you're going to have a bad time with a project like that. So be genuine, do stuff that you're actually interested in. And throughout your residency, do stuff even outside of medicine. I think people really overlook that hobbies and interests section on the ERAS application. But I know at our program, when we find folks, everybody is really impressive. Everybody has a great looking CV. But when we see that someone has unique interests and maybe it's something that we can connect with them about and we want to talk to them during an interview, that's really appealing to us. So be genuine, pursue your interests. And then obviously you also want to expand your network so that you can actually have genuine letters of recommendation, as opposed to just someone you rotated with for a month and asking them to write you a letter at the end of that rotation. It's really probably not going to be the strongest letter compared to if you built a rapport with someone over your entire training period.
Yeah, I agree. I think all these are good points. And to add to the idea of research, if someone approaches me and they tell me, do you have any projects I can jump on? It's likely I won't have anything at the time, or I would feel like they are, maybe they just want something easy. The best way I like to approach is someone read what we are doing, or someone coming with an idea and be like, hey, I have this idea. Do you think we can do it? If someone does that, even if that idea, I don't think it's ideal to do or not doable, or maybe, it will not be publishable, I will help them reframe it and make it something good. Because, I know they already made an effort and they're coming up with ideas. So I think that's a good way to approach. And always show your face to your attendings all the time. If you contact us by email at the beginning of residency and then you wait for a second year to contact us again, most likely we will not know you well. And we would like to give you projects to people we worked with already and we know they can get the work done. But if you come see us or either keep checking via email every few months, maybe we don't have anything now, but we will have something in a few months that we will give you because we know that you are persistent and you keep trying. But if you contact only once a year, I don't think you will be very lucky in getting research and come up with your own ideas. And talking about the letters of recommendations, people look at that extremely seriously because you can look excellent on paper, but people will not know what's your work ethic, because many programs had experiences where people look really good on paper, but then at work they are not always showing up on time, or they don't get along with everyone. So people look at the letters of recommendation very seriously. So always get it from someone you work with very closely. And that's why doing research with someone or shadowing them in the clinic will likely make them give you a strong letter rather than just someone you don't know very well.
And I think along with that, if your letter writer is someone that knows like a faculty or a PD at a program you're applying to that you're really interested in, or even if they don't know them, but they're willing to reach out on your behalf, that goes a really long way because all of these cardiology programs are so competitive. We're getting hundreds and hundreds of applications to sift through. So sometimes that extra personal call from your program director can be a huge factor for you.
Thank you. Thank you very much. I think that's a great answer. And it's valid for internal medicine as well. You know, I think it speaks on the importance of research and networking in building an application, right? And sometimes it may be hard. Let's say that you are in a smaller community hospital versus a large academic hospital, right? That sometimes it may feel that the options that you have for research or networking are limited or may seem limited. So just as a question that I have myself here, what suggestions do you have? Because sometimes you have residents who are maybe a little bit more shy than others, you know, and then what would you suggest as to how can I actually grow that network? Or how should I just reach out to the cardiology preceptor that I'm going to have? Should I reach out to my residency mentor, to the cardiologist that I have on staff? So how can I build this, let's say, if I'm working in a smaller community hospital?
So I started by having my program director introduce me to a cardiologist that he was friendly with and went from there. Obviously, that's a little bit more awkward than if you're directly having to work with someone as part of your training program. But anytime you have a cardiology consult and you're sharing the same patient, doctors love to talk about our patients. So if you share a patient, make sure you're in touch with the cardiologist, and that's a great time to be like, hey, I'm Allie, I'm a resident, I'm applying to cardiology. And people that want to mentor you will take that as an opportunity to take you under their wing. And then, you know, if you do abstracts or case reports with someone, that's a mentoring opportunity. When you go to a conference and present, you can meet all sorts of people there. So just take all the opportunities and keep in mind that a lot of your accomplishments will not be based on what you know, but who you know. So use everyone to help you expand your network throughout your career.
Yeah, I think that's fair. And, you know, reach out to as many people as you can. I know sometimes people, you know, can be shy, but you need to get out of your comfort zone and really get to know people. So yeah, working with them in the clinic, on the floors, and, you know, as mentioned before, if you consult them, talk to them about the consult. I think that really helps. But yeah, you need to get out of your comfort zone, and that, you need, to show yourself, right?
Definitely, thank you. And by the way, everybody, so we are gonna have like different sections that we're gonna go through this webinar. So if you have any questions, please feel free to put those in the chat. We can either discuss those at the end of each of these sections, or depending on how many there may be, we can talk to them, or we can talk about them at the end in a Q&A session, just to all the attendees that we have. Now, moving forward, okay, so let's say the resident has already been working hard, reaching out to people, and you went to different conferences, you did networking, you may have engaged in some research projects. Now it's time to apply, and this is actually the season that we are in the middle of the season that we are right now in. So what suggestions do you have for an applicant that may now be receiving an interview from a program? Anything based on your experience that it could be helpful on how to conduct that interview? And I will say afterwards as well, let's say that you interviewed in 5 programs, 7, 10, whatever number we have, what advice do you have? And again, it could be based on personal experience on how can I build that rank list?
So I think, when we interview people, one thing we look at the most is to make sure we like their personality and we think they will be a good fit. When people send you an interview, they already have seen your accomplishment and they already like your CV, your scores, your research, and all of that. Now they want to make sure you are someone they can get along with and someone they can enjoy working with. So the most important is to focus on your personal skills and be yourself. People sense when someone is genuinely nice in the interview or someone trying maybe to act up a little bit. So I think, people catch up on that with time. So just, be yourself and, show them how kind and genuine you are and nice. Stuff like shaking their hand when you walk to the room, looking, keeping eye contact. All of these are like so good, good character. And people look at that. And for example, in the interview, people will look at if other applicants are speaking like during Zoom call or during like if you are having lunch together and you are basically taking up all the conversation and not letting anyone else talk. I think people catch up on that. And many programs ask feedback from the fellows, by the way. So your interaction with the fellow can be important because the program will ask feedback from the fellows. After you finish the interview, I think sending a thank you email will help. It will never hurt to send one. But when you send one, be very specific why you like this program. We get a lot of emails. People say we like this program because it's a great academic institution or it's a great hospital and all of that. I don't think that's specific enough. You need to really be more specific of why you like it, why you like the area. And many programs, when they recruit applicants to their fellowship, they also would like to keep some of them as faculty. So if you provide them with reasons why you like the place or the area, I think that also helps in their decision.
I think the biggest recommendation I have is to practice your interview. I got really nervous when I did my interviews, so I feel like when I did my first few, maybe they were a little shakier than when I got to, my 10th, 11th, 12th interviews because I had practiced them and I really had my answers to those common questions down. So find a friend, find a mentor, and I think most of the interviews are still going to be virtual, have them do a fake interview with you and give you honest feedback. And make sure you have really good responses for like why cardiology. Make sure you stalk the program ahead of time and know what you're interested about with that particular program. If they give you a list of who's going to interview you, research that person, stalk them, figure out what their research is about so that you have something that you could ask them and impress them and make it sound like you're really interested in their program, because people want to work with people who want to be there. We don't really, even if you have a super impressive application, we don't end up ranking people really high who acted like they were totally miserable and didn't want to work at our hospital. And beyond that, I would make sure that you know your application really well. If we ask you about a paper you published last year and you don't know about it, that looks really suspicious. And then the other thing I would bring up is make sure that you have a cool background behind you. Like if you have weird stuff behind you, people will remember that, and that's not a good look for you. So like have something back there. Like I remember when I was on the interview trail, there was one guy that kept showing up with a Peloton in the background and everyone would want to ask him about the Peloton, or people would have a picture of their family or something. So having a background is important, I think. And also be mindful of the camera. When I was doing my interviews, there was one guy that didn't realize his camera was on, and some of these like Zoom meetings allow the people interviewing you to turn on your camera even if you have it off. So somehow this guy's camera was turned on and he was on the bed behind the desk, flat down, like face down in the mattress, and it was really weird. So just be mindful of the camera and just be genuine. People just want to see your interactions socially. Keep in mind that the fellows you're talking to, if there's like a main room with the fellows and they have breakout sessions with faculty interviewing you, your interactions with the fellows are so important. Even if they say, hey, this is kind of an optional thing, feel free to turn off your camera and go to the bathroom or something. The fellows have a huge say and who gets ranked and who doesn't and where you get ranked, because we want to work with people who work well with everyone at our program. And then again, like we already heard, I totally agree with sending a thank you note. We want to work with people who want to work with us. So if you don't send a thank you note, it kind of seems like you maybe aren't interested in the program.
And Ali, as a follow-up to that, to your answer, then once you finished that, you had a very successful interview, you went through different ones. How did you build your rank list? So what criteria can people use to determine, where they want to go?
I would use the interview as a way of interviewing the program to see where you want to rank them. So make a list of things that are really important to you. For me, I wanted to have good mentorship, and I wanted kind of a family feel for the fellowship. I wanted to see how the fellows interacted with each other so that I would feel like I was part of the family. So that more of the personal things were important to me. Maybe it's important to you that they have a heart failure fellowship or an EP fellowship if you're interested in subspecializing. With cardiology, it's a little bit different than other fields because we have all these different boards within cardiology. So for me, it was important to make sure that the program that I was going to rank first, second, third, that they had the ability to take the boards that I wanted to. So in cardiology, it's going to be things like ECG, NUCO, CT, MR. Those are like the main ones. So I wanted to make sure that I could get COCATS level 2 and all of those. And I wanted to make sure that the fellows in the program currently were planning to take those boards if they hadn't already passed them. And another thing is the resources to study for those boards are incredibly expensive. So you can ask about what kind of resources do you get to study from? What does your program give you? Do they give you funding for it? Do they give you academic funds? Do they pay for it? So that you know going in, okay, they're going to give me CardioSource Plus. I'm going to be able to take Echo, Nuke, and CT boards. Maybe not MR, but I'm okay with that because I don't like MR, and you really know what you're walking into, so that when you come out of fellowship, you can be marketable and get the kind of job that you want ultimately.
Yeah, I think that's a great answer. You need to see what you like to do. If you like heart failure and you want to do heart failure fellowship, then you need to go to a place that has heart failure program, right? Because then you will learn more and people will have connections to place you for a heart failure fellowship. If you like to do EP, then you need to go to a place that has EP to teach you well. And now many fellowship programs have 2+2 for EP as well, as some of you may know. So you need to see what you really like and what you want to do, and based on that, place your ranking. I would say do not place your ranking based on the city alone, because you are there for only 3 years. So it's a short period of time. The building does not matter, if it's nice or not nice. I think those things are not very important. You need to make sure you are learning well, fellows are happy, and they will treat you well. And see where the fellows end up after going. Are they end up taking the boards you like to take, doing the fellowships you want to do, being placed at, jobs that you like to take in the future, either academic or a private location-wise. Those things are very important. If you know for sure you want to practice, for example, in Orlando or Tampa area or South Florida, and you like to be in Florida, it wouldn't hurt to rank these places high, because after you finish your fellowship, you will have more network to stay in the area to work at. But if you have no preference, then you just go for the place where you want to be.
Perfect. Thank you. Thank you. Very, very good answers. And I'm gonna comment on one of the questions that we have here in the chat. So Mohammed Jawad is asking, when is the best time to send thank you emails?
I would say don't wait too long. Maybe within the first, within a week. Many places, I know every place is different, but many places, the people who interview you will send the program director basically a score sheet or what they think of you within a few days. So don't make that wait too long. But to the program director, you can reach back to the program director around the rank list one more time and be like, hey, I finished all the interviews, and after reflecting on everything, this is the place I like the most, or something like that.
I agree. I think within a few days is good. I wouldn't wait like 2 months to do it because decisions might have already been made by then and it already looked like you weren't very interested.
Alrighty, thank you. And Sophia has another question here for us. How do you think we should approach the question of what is your weakness? I have heard programs hating the typical answers of being a perfectionist or taking too much of a workload or not always being successfully saying no.
You know, I don't like that question. Personally, I do not ask it because I don't think, you know, I think just, you know, I don't like it. So I don't ask it, and I don't know what's the right, I don't know what's a good answer. I don't know if Lackey will have some advice on that.
I think if someone gives you like blanket statements about stuff like this, like nobody knows what the exact program director wants at the program you're applying to and interviewing at. I think everybody's going to have different preferences, and you never know until you're actually speaking to that person. I also, when I'm interviewing candidates for a program, I haven't ever asked that question. I tend to pick more creative questions and see what people are like thinking on their toes and having a conversation with me. That's more my style.
Yeah. But you know, in general, if you come up with a weakness, you need to come up with where you are improving it. So you should not say a weakness unless you have a way you are working on. So for example, if you want to say my weakness is I cannot perform statistical analysis on my own, then you should follow that up well with, but I started taking a course on R or Stata software, and I already doing this type of analysis. So by the time I finish my residency, this will no longer be a weakness. So you should always follow up by something you are working to improve on, and that it will no longer be a weakness. Don't just say my weakness is this. You need to follow up on what you are working on.
Thank you. And I actually will comment on that as well as reviewing IM applications. I will say this literally the same, Sophia. I've never asked that question, and I think it's a very generic question. You may hear it, yes, but I don't think there is a right or wrong answer. You know, I think it speaks more about being genuine, as Dr. Lackey was mentioning, you know, just state what you feel your weakness is. And as Dr. Ruzieh was saying, then yes, it's a great way if you can then link it is to this is the way that I'm overcoming it, right? This is if this is a personality trait or if it's something that I sometimes struggle with, this is what I'm working on in order to overcome it, as Dr. Ruzieh mentioned. But it's a very generic question in general. Just be yourself, I would say. And Jogesh is asking here, is it difficult to find fellowship programs if you have an H-1B visa?
It's not difficult, but it will make it more challenging because list of places sponsor H-1B visa. So it will be more challenging. And H-1B visa, your limit is 6 years. So if you want to do advanced fellowship, you need to think of a path to get a green card in the meantime. But the places that sponsor H-1B is limited. Part of it is because H-1B costs the institution more than what J-1 would cost if you are on a visa. So it will make it more limited. So you need basically to see your options. Some people will do, if that's an option for you, work as for a year or two and then get a green card and then apply again. That will make life easier because your options are limited with H-1B, to be honest. So yeah.
Alrighty. So as a suggestion that as well, going to what I have seen in some programs, the H-1B, yes, may be more limited, and the 6-year rule is also important. And many times, you know, applicants or residents don't know much about that. So you do have a limit of 6 years on an H-1B. Then you do have then to transition to a different type of visa. It could be an O1 or it could be a green card then later on if you want to then do some sort of advanced fellowship, but it's something to be aware of, you know, if you have the H-1B. And I'll go with one more question over here, and then we will transition to a different section. It's, do you have any recommendation tips on how to make the jump from a community IM program to more of an academic hospital for fellowship?
I think what will help you the most is research and people making phone calls for you. So if in your program there is a cardiologist who came from an academic place you are interested in, work with them very closely. And a phone call usually means a lot. If they can make a phone call to that place they came from or to where they know people, I think that means a lot.
Perfect. Yes, I think it goes in on what we were discussing about the research and networking. And one last here. Would a step 2 score of 238 be limiting for applying to cardiology?
It's not limiting, but some places put a filter, and that filter keeps changing every year based on what's the average score places get. Some places have a filter at 230, 235. Some of them have a filter at 240. So it's not a limitation, but depending on the filter of that place, you may be eliminated or not. So it really varies based on the place, to be honest. But that doesn't mean places who put filters on the people they don't know. But let's say if your score is below the filter, but we get an email or a phone call from someone, then the application will be reviewed. But the filter will apply if that no one knows you in the program. It will just be filtered out of the 1,000 applicants we get.
I think with step scores, if you feel like for anything in your application, if you feel like you're less than other applicants because of it, if you got the interview somewhere, you got to throw that out the window. And it's your time to shine and show people that you're a great person to work with and you have a great personality and you'd be a great fit for that program. If you got the interview, you made it through the filters and you got to run with it and really shine in the interview.
Perfect, thank you. All righty, now we have a couple more questions in the chat, but I'm gonna leave those to the end of the webinar. So moving to our next section, let's say now you got that email, it's December, you match into the fellowship that you wanted. Any suggestions that you may have for the applicant, for the resident at that moment to prepare for fellowship? How should they take basically the last 6 months of IM residency? What can you do? And what skills do you think are the most important? Then once you enter fellowship, how can you grow as a fellow in the program?
So I think in the last 6 months of residency, you need to review the guidelines for the most common conditions like heart failure, acute coronary syndrome, atrial fibrillation, chest pain, ventricular arrhythmias. All of these people will expect you to be good at, especially that the first few months of fellowship, you will likely have to do some sort of consult or being on call or something. So you need to be good at managing these conditions. And you need to be really good at reading EKGs because people expect you to read EKGs. A lot of residents I see, in my program and in other programs want to know echo very well. And I'm like, you will learn echo in time when you become a fellow. If you start the fellowship and you don't know echocardiogram, no one will judge you on that. It's totally fine. But if you start a fellowship and you don't know how to read EKGs well, to a certain level, of course, and you don't know how to manage a FIB to a certain level, I think that will not look very good. So these things to keep in mind. And same thing with CT and MRI. If you don't know how to read a CT coronary CTA or a cardiac MRI, I don't think people will care because that's what you are there to learn and they will teach you that. But they expect you to have at least certain level of basic knowledge of at least EKG and the most common conditions we treat in cardiology, because you will be on call and it will not look good if you missed a STEMI or if you missed serious arrhythmia or something like that.
I remember my last rotation residency was like ophthalmology or something, and I was having to watch these cataract surgeries, which were absolutely disgusting to watch. And I was so stressed about what should I be studying to get ready for fellowship. And everybody kept advising me, like, just relax, you're going to learn everything you need to in fellowship, and to focus on internal medicine, because to be a good cardiologist, you have to be a good internist and you have to pass your boards. So I think it's what worked for me was focus on studying for the internal medicine board so that you can pass that and never have to worry about that again ever in your fellowship. And since you were interested in cardiology, hopefully throughout your residency, you took an interest in EKGs and, you know, the basic cardiology stuff that you'll need coming into fellowship. And then you can start drinking out of the fire hose when you get into fellowship.
Perfect, thank you. And Ali, then once you start fellowship, you know, based on your experience the past couple of years, what can you do, you know, when you're a first year fellow? Let's say, how can then you grow your career as a fellow?
I think step one for me was being really humble and realizing how much I don't know, because you're coming into a new specialty that has echoes and CTs and all this radiology and stuff that you never had to do as a resident. So it's very humbling to see all this stuff that you don't know, and it can be very stressful. And then you'll quickly see that it's a very steep logarithmic learning curve. You'll get the right mentors, your seniors will help you out. You're going to get a good study kind of schedule. I read textbooks, I had ACC source, I had a lot of resources with my program. And when I was on the consult services early on, I just read about every single patient that I saw. Kind of the same strategy that I used in residency to study for the internal medicine boards, but now in fellowship, just kind of apply the same stuff, but the cardiology version.
Yeah, I think that's fair. You know, people will guide you throughout your first year. So just follow their lead, and they will guide you and learn from your senior fellows what worked best for them. And most places will have some sort of handout, and they will have lectures, and there are board review videos and certain guidelines and books you can read. So just learn from your senior fellows and your attendings, and they will have all the resources you need. So I don't think you should stress about that part at this level. You will have enough resources to help you.
Perfect, thank you. Now, moving forward then, and this may be something more relevant maybe for a PGY1, PGY2, it's definitely, you know, a question myself have as well as being an internist. You were mentioning, Ali, for example, there are different boards and so forth that you can take in cardiology, like CTMR, echo, etc. So that falls into the question I have is, how does it look like when you're an attending? You know, you finish cardiology. What are your options? You know, what are some general pathways that fellows take? And if you, for example, let's say Dr. Ruzieh, you know, how does it look for you now in regards to your career and lifestyle and just the work model that you have as an attending?
So the work model will vary significantly based on the practice you go to. If you go to academic practice, some hospitals now have, not all, but some of them will have two tracks. One is, they call it physician scientist, and one they call it a clinician educator. If you're a clinician educator in an academic place, you will likely make good money, and your lifestyle will not be too bad. You will have reasonable lifestyle. If you are a physician scientist, most places will give you only like half a day clinic a week, and you will do like 3 or 4 weeks of service a year, and that's it, because they want you to focus on research. But with that, I have my friend who started as a physician scientist for him on, and his first year's salary was $125. So when you are doing significantly less work, it means you are going to make significantly less money. If you are in a clinician educator track, depending on the academic hospital, you will make more money, and you will have less time for research, but it will not be as busy as a private. In a private practice, really it varies a lot what you do based on the group you go to. Are you going to be hospital employed or not? But in a private, I would say you will make a lot of money, but they will also work you hard for it. In academic, you will have more flexibility how you want your schedule to look like for the most part. But at the expense, you will make slightly less money, not slightly, more than slightly less money compared to private. So I think you need to balance what you like the most. Some private hospitals, many of them have residencies and fellowships. So if you want to teach, then you will have a chance to do that in a private practice. Many of them do that. If you like to do research and apply for grants and be part of large research, then academic places make that easier than a private practice because they will have more infrastructure and you will have more time and more people doing it. So it will make it collaboration easier. That does not mean you cannot do research in a private. You can do that very well. It just makes it more challenging and you will need significantly more effort to do that.
I think when I was deciding if I wanted to do cardiology or not, I saw some scary lifestyles of cardiologists in my hospital, and that kind of scared me away. But then I saw some of the people outside the hospital and people that weren't always in the hospital as much as I thought they might be. And I think there's just a variety of lifestyles and different pathways you could pursue in cardiology. There's the obvious ones like EP and interventional. But there's also imaging. Within imaging, there's CT, MRI, echo, and nuke. So there's people that focus on just those subspecialties. I know at our institution, we just had a fellow who did a imaging fellowship prior to cardiology fellowship. So they kind of made his own position where he's going to do 3 days a week of just imaging and structural procedural TEEs and 2 days in the clinic. I think depending on where you are, you could probably negotiate a lot and get what you're looking for if you're willing to go to the right place for that.
Okay, perfect. Thank you very much. So now let's move to then our last 10, 15 minutes of this webinar. I think we've gone through kind of the whole pathway, right, that you may have from when you're thinking of applying to cardiology, when you applied and then you match, and then how to envision your career. So thank you very much for your insight and recommendations, Mohammed and Alexandra. Now I have a couple of extra questions here that I had pending. So let's say I'm going back to one here about mentorship. So it says, we discussed the importance of our mentors at the institution in helping us establish connections. Now, how do you approach asking them to reach out to other programs on your behalf when you're also applying to your home program?
I was direct. I told them, I want to explore my options, and, they helped me. And in general, a good mentor will want you to explore your options, and people understand you may not want to stay at the same institution. Now, if your mentor is the program director, that may look weird. But if they are not the program director, then I think it's okay to ask them, hey, what places people at, and what places you can help me at. I think it's okay to be direct. And people know that because people want you to go to the best program you want, right? And the program that offers what you want. And that may not be your home institution, or even it may be your home institution. Maybe you want to move to a different city and make a new network of people. From my experience, people understand that, and people will support you explore other options. Even if they want you to stay and they love you, they will still help you explore other options. And that will not mean they will rank you less at your home institution, from my experience.
Alrighty, thank you. And another question here mentions, I recently spoke with a program director at the Florida ACC annual meeting who mentioned the oversaturation of applications, with over 900 candidates applying for just 3 spots. Despite a strong research, excellent letters of recommendation, and conference awards, international medical graduates may still struggle to pass initial filters at more established academic institutions. Do you have any advice on how to ensure our applications are considered at these strong hospitals?
I would say the most is send an email of interest, why you like them, but it has to be very specific, not generic, because people get so many all the time. You need to make your email stand out. If people know you, if you know someone who knows someone in that program, or if they can call in your behalf, that would help a lot, even if they don't know the PD. So if a cardiologist from a hospital calls the program director, it will mean a lot, even if the program director does not know them, because that shows something. And another way, if you are working on a research project or an idea, and you have someone in that institution who's working on the same idea you are working on, or same area of expertise, you can email them and be like, hey, I'm a fellowship candidate, I'm working on the same area of expertise, and I would like, basically, to collaborate with you on some research, and then you do that in your first or second year, and then when you become a third year ready to apply, you can use them to also help you get interview at that institution.
I think if you didn't yet get an interview at somewhere that you're interested in, it doesn't hurt to email them at least. I got several extra interviews by emailing places and being like, hey, I'm from this area, my family lives here, I'm really interested. It might make them take a second look at your application. But with that, make sure that your email is worded nicely and appropriate. I know here we've already gotten some very aggressive sounding emails requesting interviews, and that's a huge turnoff. And maybe there were people that would have gotten an interview and then now they're not getting one because they sent a poorly worded email. So just be cautious with that.
Thank you. Now, Hans is asking, going back to the phone call, when you are applying, basically after you applied and then you want to establish that connection, says, should the phone call come at the time of ranking or to get an interview? When you're having that mentor.
I think both. I think both will help.
Okay. And then we have, is there any certain number of research publications that you'd say programs consider adequate, and does it carry more weight if done during residency or prior to?
I don't think there is a certain number, of course, if we like two people the same exact way and they have the same, everything is the same. If someone has 10 publications and someone has one, we would likely take someone who has 10 publications more, but there is no certain number. But on the other hand, if you have one publication and someone has 10, and we feel you are someone we can work with and the other person we will not, then you will be ranked higher. So the number of publications is not everything. But if you are equal with someone else and everything else, then that's something they may use to favor one over another. Research before residency, I think, is still important, but people like to see that you continue to do work throughout residency as well.
And I think quality is also important, not just the quantity. Like if we have an applicant that has 20 publications, but they're the 12th author for every single one, that definitely doesn't look as good as someone that had, 3 or 4 publications, but they were the first author. And when we talked to them during the interview, they were really passionate about that. And it was clear that they were very involved with that research.
Yeah, 100% agree. Especially if you're doing original research, that carries a lot more weight than, like if someone has one original research and they are a first author, that will be more weight than someone having, for example, 5 case reports.
Alrighty, thank you. Justin's asking back to the question about the STEP scores. As a follow-up question to the STEP 2 score, does the same apply for STEP 3 score? I've heard mixed things regarding filtering versus just pass or fail.
I mean, I don't think there is a specific cutoff, but again, I would, study hard for it, because I don't know, if you score low on the score on step 3, people may ask you what happened, right? So you don't want to have that in your CV. If you scored low, don't worry, you can still match in a very good place. So don't worry about it. But if you did not take step 3 yet, don't take it seriously. But if you have taken it already, then it's over. Don't worry about it. But if you are someone who will take step 3, I would take it seriously, because you don't want it to look basically bad on the CV if the score is low and someone notices that and they ask you about it.
Perfect, thank you. And we have a last question here from John. What are your thoughts on away rotations and how they may benefit your application?
I do think they help, because then the people will know you, otherwise they wouldn't have known you. And there is a very good chance if you do a away rotation at a place, you will get an interview at that place. So I do think they help.
I think you also have to be really careful with away rotations. Personally, I think they've hurt some of our applicants more than helped people, because if you're going to come and rotate with us, you have to be strong. You have to get along with our fellows. You have to have your A game every day. It really weeds out the people that can fake it for a week versus the people that can be, you know, a good prospective applicant for an entire month. So if you're gonna do it, just make sure that you're gonna be there with your A game every day.
Exactly, goes in about being genuine, being yourself, and give your best. Love it. Alrighty, so if anybody has any other questions, please feel free to put those on the chat. And I think we have had a very, very productive session. I really appreciate it. And we have here, is there a filter for time of completing IM residency? I'm applying after doing my J1 waiver.
I don't think there is a filter, but you know, in all reality, people don't like to see a lot of gaps in the training. So that's something. So if you're doing a J1 waiver, that will take, you know, 3 to 4 years to finish by the time you get your green card. So to remain competitive, do more research in that time. If you can take a master's degree, so show that you have done something to help improve your chances. Because again, places get so many applicants, right? So they can easily filter out applicants they don't know, or if they feel they have not done enough work in the past few years. So you can still match, but just make sure you stay on top of your game in terms of research, maybe doing a master's degree, doing some certificates, building your network.
And I think it helps to explain any gaps. Like I had this 3-year gap between residency and now that I'm applying because I needed to move closer to home to take care of my dad who's now deceased from colon cancer. That's a lot different than someone that's like, oh, they have this weird random 3-year gap. What happened there? It makes it look like maybe they kept applying and didn't get into cardiology initially. Or if you're doing the J1 waiver, explain that and people have a better understanding then.
Alrighty, thank you. Well, if there are no other questions, then thank you, Dr. Ruzieh. Thank you, Dr. Lackey. Really appreciate it. Thank you for sharing this hour with us. And thank you, everybody, for attending. In behalf of the ACP Florida chapter, really, really appreciate your attendance and the support for all of our residents. And then we're looking forward to a very successful application for all of you. Yes.
Thank you. Good luck, everyone.
Thank you.
Good luck, everyone. I hope you all end up with the best program and that you're all really happy.
Thank you. Bye, everybody.